Welcome back, you beautiful souls. Thank you so much for keeping it locked as we now kickstart a very important conversation. Yes, we're a couple of days early, but being a Medical Tuesday, this is our focus today. World TB Day is observed annually on the 24th of March to raise awareness about TB and efforts to end the global epidemic. Now marking the day in 1882, in fact, when the bacterium causing TB was discovered. And the World TB Day will focus on urging countries to ramp up progress in the lead up to the 2023 United Nations high-level meeting on this very subject, which offers opportunities to raise visibility, yes, but also political commitment at the highest level. And with us to discuss the topic further, our Associate Professor at UWC, Renier Coetzee, and TB advocate, Dr. Delian von Delft. Thank you so much for joining us this morning. Days like this are always interesting to approach because it's a very big problem that has a very, very personal effect or manifestation in someone's life, and we take nothing away from what this does mean within the lives of those who are currently dealing with TB. But we have to look at this in a general sense to understand where we are, so hopefully we can mobilize the masses. But Renier, maybe a good place to start is, what is TB? Can you explain to us what is going on in the body and why this has become such a massive problem within our kind of yearly medical fight? It feels like this is a battle that we are constantly waging.
Yeah, so TB is an infectious disease caused by the bacterium, Tuberculosis bacterium. It affects the lungs mainly, so it is an airborne disease. So anyone that breathes, when you sing, when you sneeze, when you cough, you have a risk of actually contracting TB. So we know that someone that coughs or sneezes, they then spread this disease. It's in the air. It's not like the coronavirus or any other flu-like virus. When you touch a surface, so you don't need that hand washing all the time because it's in the air. So that's how you contract TB. So we can talk about the signs and the symptoms, but I think that's what we want people to know, is that it is an airborne disease.
Which is a little bit terrifying to know that it's there. When I talk about this being a personal journey, this has been a very personal journey for you, Delian. Give us a bit of perspective on your own path and what's led you to the space of advocacy now.
Sure, thanks for having me. So I was diagnosed with TB in 2010. Can't believe it's been 30 years. But unfortunately, I was exposed at work being a doctor. And it was my first episode of TB, but it turned out to be what we call multi-drug resistant TB, which is the TB bacteria that basically can develop resistance to the core antibiotics that we usually use to treat tuberculosis. So what followed for me was 18 months of quite harsh treatment. I had to take 7 different antibiotics with lots of side effects.
That's going to hammer your body, sure.
Yes, so, and it was all okay except for one irreversible side effect that was hearing loss that unfortunately I started developing 8 weeks into my therapy. And at that stage, the prognosis for MDR-TB was not very good. Only 50% of patients survived. So the doctor said, well, rather deaf than dead. But I was unwilling to lose my hearing. I couldn't imagine a life without music and not being able to practice as a doctor, being able to use my stethoscope and communicate with my patients. So I was very fortunate through some medical contacts. I was one of the first patients to access a new antibiotic that was still undergoing clinical trials at that stage. And I could stop the antibiotic that was causing the hearing loss. So I just have a bit of high frequency hearing loss, which doesn't affect my daily life, and I got cured. But the experience just opened my eyes to the immense suffering that patients have to go through, and it just motivated me to become involved in advocacy for especially improved treatments, but also support for TB patients. And I'm very happy to say that today the horizon looks much better for drug-resistant TB patients through some groundbreaking efforts of the South African scientific, medical, and government health communities. Our drug-resistant TB patients can now be treated within 6 months. And the antibiotic that they used to use that causes hearing loss is not routinely used anymore.
First of all, congratulations, I suppose, but well done for fighting the fight. But it's crazy to me that you had to go through all of that to get to this point of understanding. And I'm so glad that you've recognized that you are a very lucky small percentile of people who have access to that. This speaks to a much larger network of action, which is amazing. And that seems like a post-COVID, we are working together in a way, certainly within medical spaces, that we haven't. Just very quickly, Renee, you talk about signs and symptoms. It seems like it can manifest in ways that don't just represent the lungs, but what are some of the most, kind of the biggest warning signs, those major red flags when it comes to TB?
So TB is an infection mainly of the lungs, but it can also spread to other parts of the body, like the brain, the kidneys. It can spread to your knees, the abdomen. And that's what we usually call extrapulmonary TB. But the TB that I think most people will know is TB of the lungs. And so that usually presents with symptoms like coughing for more than 3 weeks. And your sputum can contain some blood, but not always. They've got night sweats, chills, and weight loss that is unintentional. So those are the main symptoms that a healthcare worker will look at when they consider you having TB or not.
If you are experiencing any of those symptoms, we don't want you to latch onto that. We would rather want you to get checked out. As always, we say speak to your doctor first if you feel in any way nervous about anything that we're talking about today. But I think the most important element of this discussion is to spread the word, because it looks like there is a network of support that a lot of people don't know is even there. And if you've got any personal perspective, please share it with us. 063 408 8863. That's our WhatsApp line. Drop us a voice note.
It's my feel-good breakfast show.
Welcome back as we continue our discussion. Yes, just a little bit out of breath around World TB Day with Associate Professor at UWC, Renee Coetzee, and TB advocate, Dr. Delian van Delft. And if, I think maybe this might be a slightly alarming fact, did you know, during 2021, the tuberculosis mortality rate increased for the first time in over a decade. If you have any questions or a personal perspective relating to TB, please drop us a WhatsApp voice note, 063 408 8863. Whew. I was obviously doing a push-up challenge before the break, or obviously doing something physical, so I am a little bit out of breath. Renee, when we look at numbers like that, we would think in this modern age of information sharing and medical might, that TB that's been around for as long as it has, we would have a control. We would have at least some kind of footing. It feels like we lose a little bit of ground, and if anything, the numbers are saying that we've lost a little bit of ground. What's causing that? What's driving this process?
Yeah, it's a very, very interesting finding. So in 2021, the World Health Organization Global Report actually showed that we actually went back a decade back in the gains in terms of how we manage TB. So the mortality rate has increased, and the experts in the field think that the reason for that is probably the COVID pandemic. What we saw during COVID, and as you know, we had severe lockdowns in South Africa specifically, we saw that there was no access to TB services. Our patients did not seek care at the same time, and therefore there was no testing and no treatment was initiated. We also didn't see that patients were actually getting TB preventive therapy. So if you think about that, that could potentially be one of the biggest reasons why we went backwards in terms of mortality. We are slowly seeing that there is an improvement, seeing that the services are up and running, but still in the academic field, researchers have channeled all their funding, all their resources to COVID. So less research and less attention was actually given to TB.
It's almost like we need that. I don't want to make light of this at all and say we need like a medical lottery to see which is the focus area each year, but it is starting to feel like that. If we apply our collective might and intellectual might, we can bring about change. And as much as this must be so disheartening for you to hear numbers like that, it says to me that we can change it. Because these are not impossible things to change. These are all things that we can have an effect in. There is a stigma attached to TB. There is a socio-economic element that plays a role here. I will never forget sitting next to a man who had very advanced TB and being able to sneak a peek at his x-rays of his lungs, and it was terrifying for me to see. And I could see the amount of pain he was in. There is a reason why people are not seeking help. There is a reason why there is a disconnect between those health providers and the majority of the South African market. The stigma attached to this, why do you think that is? And in your heart of hearts, having spent time thinking about this from a very personal perspective, how do you think we address that?
I think stigma comes from a lot of false beliefs. So people believe that, it's only poor people that get sick. Whilst it's just in poor communities, people live in crowded conditions. They use crowded transport mediums, so they have a much higher likelihood of being exposed to the TB bacteria. And because of these false beliefs, people don't talk about it when they get TB. They're sort of ashamed about it. We see TB in all socioeconomic backgrounds.
Levels, yeah.
And I think that's what our organization really wants to do, is to try and encourage people to not be ashamed, to share their stories, so that we can break that stigma, and we couple sharing personal stories with the facts that TB can affect anyone. It doesn't matter what your background, your socioeconomic status. Even if you're young and healthy, like I was, you can get TB.
You're still at risk.
Yes.
There is obviously an opportunity to do something big around World TB Day. It does require us to cut through all the clutter. This feels like something that would be relatively difficult to diagnose, because it sounds like a lot of different sicknesses. How do we diagnose this? I say we, obviously, but how do we approach something like this when you start to break it down and look specifically at TB?
So it's actually very easy. We've got tests available in South Africa that can very quickly tell us whether you have TB of the lungs. And at the same time, these tests can actually tell us whether you have a resistant form of this bacteria. So we know exactly what treatment to start immediately. So in general, a healthcare worker will ask you a few questions. It's what we call a screening. They can then also ask for a chest X-ray. And what we've seen in some of the studies, that chest X-rays can actually be very helpful in making a diagnosis. But all we need from an adult is some sputum that's sent away. And in the past, we had to culture it, so look at it under a microscope. That can take 2 weeks for the bacteria to grow. But with the newer test, within 2 days, we can inform you whether you have TB or not, and, like I said, whether it's a resistant form of TB.
And now there are treatment options to scale according to that response. It feels like the disconnect here is not the will, is not the capabilities to be able to treat it. It's just literally that, a disconnect between those that are experiencing TB and those that are there to help. So please, if you are experiencing any of the symptoms that we have spoken about today, speak to a healthcare professional. A test is easy. The fallout will come if you are sick and you cannot provide for your family, you cannot go to work, you cannot get out of bed. That is what we want to avoid, not you seeing a doctor to find out the diagnosis. That's the easy part. We want to help you to fight this in whatever way we can. And if you have a personal perspective, we need to hear you today. 063-408-8863. Drop us a voice note.
It's my feel-good breakfast show.
Welcome back as we wrap up our discussion around World TB Day with Associate Professor at UWC, Renia Kutsia, and TB advocate, Dr. Deliane von Delft. Thank you so much for joining us bright and early this morning. TB is the leading infectious disease killer in the world. We should have opened with that one. In South Africa, more than 300,000 people contract the disease every year, and on average, there are 180 deaths per day. I would like to let that sink in for just a moment as we hear a voice note from John. Let's get John's perspective this morning.
Good morning, John here from Cape Town. I want to find out, at my workplace, lots of people have been diagnosed with TB. My son actually was infected with TB from the work people. Is there anything that the work can do to get maybe a nurse or someone to come test everybody at their workplace? Is that possible?
Great suggestion. It speaks to a larger network. I don't know who would like to take something like that on, but is there an opportunity, knowing that this is ever present and airborne, is there a way that owners of buildings, companies can protect their staff? What's the first step?
So as I said earlier, TB is airborne and TB likes enclosed spaces. So in a recent guideline that was developed by the South African Department of Health, we see that they say, what is a close contact? And a close contact is not someone that's just staying with you at home. A close contact can be anyone that you spend a lot of time with during the day. So it can be a classmate in school, it can be the teacher, it can be someone that you travel with every day to your job. And yes, it can be someone that works very closely with you in an enclosed cubicle. So what we are saying is that anyone that works in that environment and they know that someone has TB, they are actually eligible for TB preventative therapy. So there's therapy that you can take for 6 months or up to a year that can prevent you actually then having the disease, being ill with symptoms of TB. But like you said, the Occupational Health and Safety Act also should make provision for that, so that that company or that organization needs to have a protocol in place where people can be tested and then also access treatment.
Gain access. And is it easily accessible? Can companies access this kind of testing? Can individuals access, this kind of pre-treatment is amazing. Is there access to that? Do we need corporates to step in and start sponsoring access? Where is that battle line drawn?
Yes, I think there's been a couple of barriers identified why there's poor access to treatment. And so the medical community have looked at this, and one of the factors is a delayed diagnosis. And there's lots of factors contributing to that. But firstly, we want to create a community demand for testing so that people want to test, and the health systems can also improve to make it more accessible to go for testing. So, for example, provide testing services available over weekends or between 5 and 6 in the afternoon, so that people don't have to...
People are working, yeah.
Yes, or testing at the workplace, for example, if there is a TB outbreak. We also want to create awareness so that communities create the demand, so that, as I've seen with COVID, where people would stand in queues to get tested. Yeah. We want that for TB. We want people to say, I want a TB test, I want to know my TB status.
I think by virtue of the fact that you can be proactive in that way is amazing to me, and that should be incentive enough. Even just, I'm hoping bosses are just going to be sitting up saying, this is how I can protect my cash flow, my workforce, and keep my company going, because there is a very practical element here. When we look at TB as a global awareness campaign, because clearly this is a global problem, a very South African problem, I understand that. Yeah. But what do we need to do as those of us who have a platform, this World TB Day? How do you feel we can best aid your efforts that are working on the front lines?
Yes, so there's actually a lot that you can do. First, like Deline said, go and get tested.
Let's do it, yeah.
We need people to go to a healthcare worker, get tested. You can get screened. The Department of Health, if you check on their website, they've got a TB screening app. So it's a WhatsApp number that you can contact, and they can guide you to the nearest place to get tested. But I think what we want people to do is on their social media platforms, wherever they find themselves, talk about TB. Because once we start talking about TB, we will also break down those barriers of stigma.
Absolutely love that. Deline, in your advocacy, what support do you need?
I think one must realize it's a very traumatic experience for a person to be diagnosed with a life-threatening infectious disease that they often have to face in isolation. Yeah. They don't only worry about their own health, they worry about all the loved ones they've possibly exposed. They worry about losing their job because they're missing days of work. They worry about what their employer would say. And at the same time, they have to start this harsh regimen of antibiotics that still has a lot of side effects, and it's still a prolonged time. 6 months is a long time to take antibiotics.
Chunk of your life, yeah.
So I think it's very crucial for everyone, not only friends and family, community members, to support these individuals. We need peer group support, and that's what we try to do at TB Proof, but also employers to support these individuals so that they can get cured and they can return as healthy, contributing community members. TB is a curable disease. Yes. It's fully preventable, treatable, curable. Just look at President Nelson Mandela, who also was a TB survivor, what he accomplished in his lifetime. So we need to really provide support. And if we all can do that, I believe we can end TB in our lifetime.
Well, I think we've proven it. And to be quite honest, Elaine, anyone can tell you, can dispute what you're saying, and you can tell them, no, I am living proof that you can beat this thing, and you can do it by connecting with the network around you. So thank you for being that network. We didn't even get into the work that you're doing at UWC, so keep fighting that battle on every level. Thank you so much for being here today. Hopefully, this has sparked action in your life. Bottom line, go and get tested.